I will never see health insurance the same way after learning this. Health insurance in Canada can be confusing, but don't worry, I've got you covered. From provincial plans to private options, I'll break it all down. Welcome to the world of Canadian health insurance, where access to health care is considered a right for all. Whether you're a new resident, a student, or just curious about how the system works, this video will guide you through the ins and outs of Canada's healthcare options. Hi there, I'm Abi, and today we're looking into Canadian health insurance, how it works, what it covers, and most importantly, your options. So pay attention now. Canada's healthcare system is primarily publicly funded, and each province or territory runs its own healthcare plan, which is often referred to as Medicare. This means the government provides basic healthcare services free of charge for Canadian residents, covering a variety of essential services like doctor visits, hospital stays, and emergency care. But hold on, let's not get ahead of ourselves. This basic coverage doesn't include everything. Some things like prescription drugs, dental care, and eye exams may require additional coverage. Here's the catch. While the system is universal, it's administered at the provincial and territorial level. This means what's covered and the waiting times can vary depending on where you live. For example, in Ontario, the plan covers most basic healthcare, while in Quebec, residents may have access to additional services like free dental care for children. It's always a good idea to check your province's health plan details to know exactly what's included. Now, what if you need more than just the basics? That's where private health insurance comes in. This is where you'll find coverage for things like prescription medications, dental care, vision care, and even some elective surgeries. Private insurance plans can be purchased through employers, or you can buy them independently through brokers like me. Many employers offer health benefits packages, which can help cover those extra costs. These plans often vary widely, so be sure to review what's included and what isn't. Some private plans may even cover things like physiotherapy or mental health services. Provincial health insurance plans. These plans typically cover core services such as hospital visits and stays, emergency services, doctor's visits and consultations, maternity care and births. But things like prescription drugs, dental care, and cosmetic surgeries aren't covered under the provincial plans, which is why additional private insurance is often a good idea. If you're visiting Canada or temporarily living here, don't forget about travel health insurance. Visitors and temporary residents, such as international students, are not covered by provincial health insurance, so getting the right coverage is essential. Make sure to buy travel insurance that includes medical coverage, including emergency medical costs, repatriation, and extended hospital stays. Students, listen up. Whether you're studying in Canada or abroad, you'll need health insurance to stay covered while you're in school. Many Canadian universities offer health insurance plans for their international students, which usually cover basic services, including doctor's visits and prescriptions. But make sure to read the fine print. You should also check the duration and limits of your coverage. Alright, for permanent residents, so how do you actually apply for your provincial health coverage? It's a fairly simple process. First, you'll need to apply for your health card through your province's health ministry. In most cases, you can do this online or at a local office. It's typically free, and once approved, you'll receive a health card to show whenever you access healthcare services. Lastly, a few quick tips to keep you on track with your healthcare coverage. Know what's covered and what's not. Keep your health card updated. If you change provinces, remember to update your coverage. Consider supplemental private insurance for extra services. And that's a wrap on decoding Canadian health insurance. I hope this clears up some of the confusion and helps you make informed decisions about your healthcare options. Be sure to like, share, and subscribe. Until next time, stay safe.